Welcome back to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today is one of our recent award recipients, Dr. Bernadette Goudreau. Dr. Goudreau is a chief resident at the University of Virginia, soon going into vascular surgery. Welcome, Dr. Goudreau.
Thank you for having me.
Pleasure having you here, and congratulations on your award. Just as background, the Jameson Chassin Award is an annual award bestowed upon a chief resident by the Chassin family and other contributors to the Memorial Fund, as well as the American College of Surgeons Foundation. And according to the direction of Dr. Chassin, the Chassin family, is for professionalism in general surgery, presented to a chief resident in general surgery who exemplifies the values of compassion, technical skill, and devotion to science and learning. Congratulations, Dr. Goudreau, on having been the recipient of this very prestigious award. First, perhaps you could tell us, how did you come to learn about the award and what did you need to do to be recognized?
So I actually had not previously heard of the award myself. My program director had sent me an email with some of the information about the award and had asked if I would be interested in compiling an application to apply for it. And I had looked through some of the information there, and I wasn't quite sure necessarily what qualifications an individual should have for such a thing. And so what we did is we sat down and talked about it, and he felt pretty strongly that the evaluations that I had from the other faculty members of my program, as well as the students I had worked with, and then other departments that we kind of interfaced with quite a bit. So as far as the emergency medicine program directors and their residents, ICU folks, the medicine side of things, and comments from them he had suggested would be kind of in favor of my applying for it. So that's when we had decided it would maybe be something that would be in my best interest.
Well, certainly impressive that out of all the chief residents in the country and all the programs in the country, you recognized for these tremendous assets of compassion, technical skill, and devotion to science and learning. What advice do you have for others? I mean, how does one achieve this level of recognition to be so compassionate and so skilled and so devoted to science and learning? What do you tell other residents?
I think I definitely have to credit one of my medical school mentors and deans. And I remember like very early on in the process, so we had the same dean for all 4 years of medical school. She had always reiterated that you have to pick a specialty that you really enjoy doing, that you would do it every day, regardless of kind of the challenges, but also something that you could kind of see just different avenues opening up in your future. And so that's kind of why I loved general surgery so much, is because I had started as a student just being able to see the clinical side of things, really enjoying the patient care, the connections that you have both in the elective and the emergent setting. That's like something that I think is kind of unique to the specialty, is that you can kind of see people kind of in all aspects of their life. But that there's also a lot of really interesting progress in the surgical arena as well. And the general surgery program at UVA affords the residents kind of 2 years of dedicated research time. So you can really think about the scientific aspect of things, kind of like the quality improvement aspect of our practice, and be really, really engaged in an academic side of surgery as well. So I really like that there's a lot of multifaceted aspects to it, but it kind of allows you then to dive in as an individual and be really invested, and you can show up to work every day with some enthusiasm and some kind of really heart in the work, and it's not just kind of clocking in and clocking out.
That's great, and that's refreshing to hear, because certainly passion for excellence becomes contagious to other people. They like working with you, people who are your faculty, people who are your peers, and people who are learning from you, medical students and such. Everybody is going to be a beneficiary. But the award covers some, what one might potentially consider rather divergent group of skills. So compassion and technical skill, which are quite different in terms of at least the vocabulary definitions. So in terms of the technical skill, what's your advice to residents there in developing technical skill?
Definitely. I think one of the aspects of surgery is that you always have to kind of keep in mind that it is a privilege to be able to do what we do. And so you're operating on like another human being. And so, it's just as much as you wouldn't want to show up to any other job ill prepared or underprepared. It's the same thing for the operating room. And also taking it upon yourself to realize that, you get a lot of experience when you're in the hospital or you're operating on patients in the OR, but there's a lot of things that you can learn, a lot of nuance from reading old textbooks, new textbooks, talking to individuals, talking to more senior people, and just kind of adopting it as like your craft almost as well. So kind of taking pride in what you do, almost like an artist would. And so wanting to be, the best that you can be at even the little things. And so I think really kind of devoting yourself to the little things makes the bigger things come together in a much easier way.
And it sounds like, perhaps not to be presumptuous, but these traits are things you developed within yourself, or did you take any classes or courses to help you in these directions?
For the most part, it's just been interest, but I will say that when there's especially once you're younger resident, if you see opportunities available for all aspects of like professional surgical development, taking those early when your habits aren't fully formed, when you haven't been doing something, for 5 or 10 years, it's much easier to be in that malleable state to kind of develop traits or to kind of set yourself up for kind of maturing in that direction if you take initiative early to do those things.
Well, that's great. So clearly you devote a lot of energy and enthusiasm to your work, and outside of work. What else do you do that helps round you out?
Outside of work, I'm very fortunate to be in Charlottesville, Virginia, which is in the middle of the state. So we've got really great access to lots of outdoor activities. I'm from the Midwest, so the climate here for me is much more temperate. So I feel like it's a kind of a year-round area to be able to hike and to kayak, and to be able to do something that doesn't involve the fluorescent lighting of the OR. So it's kind of nice.
Well, that's great. Again, I congratulate you on your award. I think it's absolutely tremendous accomplishment as a chief resident to get that type of national recognition by the American College of Surgeons. And I'm sure we're going to be hearing from you in the future in your vascular surgical career.
Thank you. Thank you.
All right. Well, again, congratulations and best wishes.